بسم الله الرحمن الرحيم الحمد لله والصلاة والسلام على رسول الله وعلى آله وصحبه وسلم أجمعين. This is continuation of how ChatGPT involving radiology training, and in this tutorial I asked the ChatGPT how to read the chest X-ray, and his answer as the follows. The first part of this, how to read the chest X-ray, he answered the basic steps, and he included the patient information regarding age, sex, clinical history, and reason for examination, and technical evaluation, proper position, inspiration level, adequate penetration, no motion artifact. Systemic approach, airway, tracheal position and size, endotracheal tube if it is present or not, lungs, evaluate the lung volumes, lung parenchyma, interstitial or alveolar pattern, involvement of both lungs, and compare the both lungs, pleural spaces, cardiac and mediastinum. Look for heart size and shape, mediastinal masses or other pathology in the mediastinum. Great vessels like aorta, superior vena cava, inferior vena cava, etc. Bones and soft tissue, look for rib cage, thoracic spine, and soft tissues. Differential diagnosis based on radiological finding and correlate with the clinical information. Then lastly, he write the reporting. He said description of the finding, impression, conclusion, and recommendation for further imaging and management. These are the key steps in systematically evaluating a chest X-ray. As we said, he reviewing the patient information, assessing the technical quality of the image, performing structural analysis of the airway, lungs, cardiac, and mediastinum structure, and bones and soft tissue, and formulating differential diagnosis based on radiological finding. Then, lastly, reporting the findings and the impression in a clear, concise manner. Then I asked the ChatGPT more evaluation of the chest X-ray, and he answered the question, and he gave me the common chest X-ray finding. In the airway, he said tracheal deviation, look for tracheal deviation, look for airway narrowing and foreign bodies. And in the lung parenchyma, look for consolidation, nodule masses, interstitial lung disease, atelectasis, and pneumothorax and pleural effusion in the pleural spaces. For cardiovascular, look for cardiomegaly, aortic aneurysm, pulmonary edema, pericardial effusion, and bones, soft tissue, look for rib fracture and the spine abnormalities and soft tissue masses. Common to prior image, evaluate changes over the time, comparison for the previous imaging, and assess the progression or resolution of the finding if there is previous X-rays, integrating clinical information, correlate radiological finding with the patient's symptoms, medical history, and other test results. Formulate a comprehensive clinical impression. Communicating finding, provide a clear, concise, structured report, highlight the key findings and the clinical implication, and recommend appropriate follow-up or additional imaging. Continued education, stay to date with the latest radiologic literature and guidelines, participate in educational activities and conferences, continuously refine your interpretation skills. This is the extent mind map covered the, as we said, the additional key aspect in reading the chest X-ray, common chest X-ray finding regarding the airway, lung parenchyma, cardiovascular system, and bones, soft tissue. Importance of comparing the current chest X-ray to prior imaging study, integrating radiologic finding with other patient clinical information to formulate a comprehensive impression, effectively communicating the finding and recommendation in a clear, structured report, emphasizing the importance of ongoing education and skill development to maintain a professionally in chest X-ray interpretation. By following this systemic approach, clinician can accurately interpret chest X-ray and provide valuable insight to guide patient management. Thank you for listening and hoping to see you soon in another talk. سبحانك اللهم وبحمدك أستغفرك وأتوب إليك.